Taking care of our health is important for us and our families. There are some things that can affect our health that we may not know about until it gets bad, such as cancer. In our culture, people often only go to the doctor when they feel sick. Sometimes, if we wait until we are very sick, it may be too late. It is best to get a checkup while we feel well, so we can stay healthy. Women and men over 50 who have regular checkups, such as colonoscopies and stool tests for colon health, are more likely to stay healthy. The colon is called the large intestine. It's a long tube-shaped like organ near the end of the digestive system. The rectum is the last part of the intestine where the stool is expelled through the anus. Combined, the colon and the rectum are called colorectal. When you eat, food goes into your stomach, and then it passes through your colon before it exits your body. The colon helps absorb water and salt into the body. It pushes out the waste material and toxins that your body doesn't need. Cancer of the colon and rectal, also known as colorectal cancer, is the third most common type of cancer diagnosed worldwide. Deaths from the colorectal cancer have decreased with the use of colonoscopies and fecal occult blood tests, which check for blood in the stool. The risk of colon cancer increases after age 50, but there are things we can do to find it early before it gets bad. Colon cancer is cancer that starts in the colon or rectum. This happens when colon cells grow uncontrollably and create a lump inside your colon that can spread to other parts of your body or block stool from exiting the body. Both men and women can get colon cancer. It is most common after the age of 50. Your risk of getting colon cancer increases the older you get. There is also increased risk if someone in your family had colon cancer. Then you may need to be tested at age 40 or younger. Talk with your doctor if someone in your family had colon cancer. Symptoms of colon cancer are losing weight and you don't know why, a change in bowel habits such as diarrhea, constipation, narrowing of the stool, feeling that you need to have a bowel movement and it doesn't go away when you do, rectal bleeding, blood in the stool, cramping in the belly, vomiting, or weakness and fatigue that doesn't go away with sleep. Colorectal cancer often begins as a growth called a polyp, which may form on the inner wall of the colon or rectum. Polyps are not cancer, but some polyps can become cancer over time. If you do a screening, the doctor can catch it early and remove it. Finding and removing polyps can prevent colorectal cancer. Colon cancer is treatable if we find it before it's too late. After a screening, if the doctor sees anything abnormal, they may call you back for further testing. This does not mean you have cancer, but the doctors want to see if there's cancer or some other condition that needs treatment. If the doctor finds cancer, they will check to see if the cancer has grown into the wall of the intestines, reaching nearby organs, or has spread to other parts of the body. After they know more about the type of cancer and the level of cancer, the doctors can treat the disease. Some treatment options are surgery to remove the cancer cells, chemotherapy, and radiation. Screenings for colon cancer. There are two types of common tests for colon cancer. You can talk to your doctor or nurse about which test is best for you. They are fecal occult blood test, FOBT, and colonoscopy. The fecal occult blood test, FOBT, is a test to check the stool, solid waste, for blood that can only be seen with a microscope. A small sample of stool is placed on a special card or in a special container and returned to the doctor or laboratory for testing. Blood in the stool may be signs of polyps, cancer, or other conditions. This test is similar to the test you may have done at the health clinic, but they are looking for parasites and not cancer. However, this test is for signs of cancer. This should be done every year after age 50. Ask your doctor for instructions, but some steps include 1. Pull out the materials from the box. 2. Sign your name and date of birth on the card or tube. 3. Wash your hands and put on the gloves if given. 4. Place plastic wrap on the toilet bowl. 5. Put down the toilet seat. 6. Proceed to have a bowel movement. 7. Open the first card that was given to you. 8. Use the sticks given to collect a sample of stool. 9. Apply the first specimen of stool as a thin smear in box A. 10. Flip the wood stick and reuse it to obtain another sample from a different part of stool and place it in box B. 11. Allow specimen to air dry for 5 minutes. Close the card before placing it in the envelope. 12. Collect the second sample on a different day or another bowel movement and place it in the second card. 2 samples, box A and box B. Collect the third sample on another day or another bowel movement in the same manner and place it in the third card. 13. Make sure the cards are labeled with your last and first name, your date of birth, and the collection date of every slide. Place the card in the envelope provided in the kit. 14. Return slides to the clinic within 11 days after collecting the first specimen. And finally, you cannot mail it, you have to bring it in person to the doctor's office. The second most common type of screening is the colonoscopy. They use a flexible camera for screening and removing polyps or samples for tests for cancer. The colonoscopy looks through the entire colon for polyps and abnormal bumps. You can also choose to take some medicine that will let you relax, and many people sleep through the procedure. The test should only take 30 minutes to 1 hour. It should not cause any harm or pain to your body. The colonoscopy should be done every 10 years. You will also need to prepare your colon for the day before. Colonoscopy prep. Let's review the process preparing your colon for the exam. Your doctors may ask for a slightly different process, but most will be very similar preparation steps. First, talk to your doctor if you're taking any medicine. 5 days before your exam, don't take blood thinners such as aspirin, Advil, ibuprofen, Plavix, Coumadin, and Agranox. However, you can take Tylenol if needed. Step 1. 24 hours before your exam, the doctor will give you instructions to only drink clear liquids. You will only be able to drink fluids for the day and night before the exam. This means no solid foods such as meats, rice, or vegetables. Some acceptable liquids are clear broth, clear juice, Gatorade, tea without milk and without sugar, and Jell-O. The doctor needs your colon to be like a clear road. The more you avoid solid foods, the easier it will be for your doctor to see the unusual polyps or tissue. Step 2. Drink the cleansing solution called Go Lightly at the recommended hour. You will need to drink a large amount of this fluid to clean out your colon. First, 1 cup or 8 ounces every 10 to 15 minutes until half the container is empty. It should take about 2 hours. Then, put the leftover liquid in the refrigerator. Step 3. Drink the last of the cleansing solution 6 hours before the exam and then wait to eat or drink until the exam is finished. Step 4. Be on time to attend your clinic appointment. And finally, Step 5. Put on the gown they give you and follow the doctor's instructions. After the colonoscopy, you can expect to be sleepy after the exam. So have someone drive you home and plan on resting the rest of the day. You may experience some extra gas and bloating in your stomach, as well as a small amount of blood when you wipe. However, on rare occasions, if you experience more blood, fever, or pain, please contact your doctor right away. Results should come within a week of your exam. You may call the doctor's office for your results, or you should receive a letter in the mail. If you do not understand your results, call the clinic and ask for an interpreter. Any abnormal results do not mean you have cancer, but you may need further testing to see if there's any type of problem in your colon that they can help treat. Prevention is the best protection. As always, it is better to prevent cancer than it is to treat it later. Some ways that we can help prevent cancer is to 1. Get regular colon cancer screenings when you turn 50 years old. Or, if you have someone in your family with colon cancer, you may start screenings at age 40 or younger. 2. Control diet. Less red meat, less fatty foods, more leafy greens, vegetables, and water. 3. Stop or limit alcohol use. Drinking alcohol is not good for your health. 4. Stop smoking. 5. Maintain a healthy weight. And finally, 6. Stay physically active. Staying healthy is not only important for you, but it's important for your family too. Connecting to your doctor for regular checkups is a great way to stay healthy.